I think to understand clinical pharmacology, which is a strange specialty, people often wonder what exactly is clinical pharmacology. It's quite helpful to look back at our history. So clinical pharmacology arose in the mid-20th century at a time when we didn't really have drugs. At the beginning of the NHS, for example, we didn't have many drugs to treat many conditions, and a whole raft of new molecules were discovered and developed as medicines. And so in the 50s and 60s, clinical pharmacology was a research specialty where doctors were developing new medicines. And a very famous clinical pharmacologist, Professor Sir Colin Dollery, dubbed this the age of excitement. Fast forward now to the 1960s, and the harms of medicine started to become apparent. We had, for example, thalidomide used for morning sickness causing birth defects in many babies. And this led to regulation of medicines. I call the age of regulation, where the Medicines Act came about in 1968, and also where pharmacologists became involved in setting up things like the yellow card scheme for reporting adverse drug reactions, and in the Commission on Safety for Medicines. Then we come to what I call the age of darkness. And what happened was, first of all, that medicine organised into organ-based specialties, and we lost general medicine. And clinical pharmacology doesn't have an organ. Secondly, the universities organised into divisions, and individual disciplines were lost. So the visibility of pharmacology became much less. Also, Big Pharma started to leave the UK, and so people couldn't see pharmacology as a career, and so people stopped applying for it, and so the specialty shrank. Towards the sort of late 1990s, clinical pharmacologists that remained were calling for, pointing out that doctors were very bad at prescribing. And initially this was just felt to be a bit of where sort of trying to find a niche for themselves in society. But the GMC, the General Medical Council, commissioned a study which was called EQUIP, which was done by an independent group in Manchester, Tim Dornan and colleagues. And this did truly show that there were many, many errors in prescriptions. And this led to what I call the age of prescribing education, where clinical pharmacologists towards the end of the 90s, beginning of the 2000s, started to teach prescribing instead of just clinical pharmacology and therapeutics. And so arose the Prescribing Safety Assessment, which is a national assessment of prescribing safety run by the British Pharmacological Society in partnership with the Medical Schools Council. And now all doctors have to do this at the beginning of their foundation training, and it is led by clinical pharmacologists. Fast forward now to where we are now, 2017 and 2018, and we now have a great epidemic of polypharmacy. We have the advent of pharmacogenomics. And as never before, clinical pharmacology is needed in the NHS. And so we've now reached what I call the age of Enlightenment, where we're going to realise our value for the NHS. And so hopefully that explains why clinical pharmacologists are involved in research, in regulation, in teaching, and in clinical practice. It's a strange specialty, but it's a very rewarding one to be part of.